in such a way that there will be no possible transmission of infection from one person to the other. So take note that our main objective in dental treatment is to break the chain of the transmission of infection once it is already identified. So that's the reason why if a patient comes to your clinic and told you that he is not feeling well, or if not, there is a symptoms of flu or signs of flu, okay, and so on and so forth, then all you have to do is to dismiss the patient, okay, and ask the patient to come back once he's already well and good. The reason being, if we are going to continue with the treatment, of course, you cannot treat the patient with the mask on. Hindi pwedeng nakamaskara yung pasyente nyo, naka-face mask siya, then you go on with your dental treatment. That is unimaginable, di ba? Paano mo ititreat yung pasyente pag nakasara yung kanyang bibig? So even though you wear your mask, it's not a guarantee that you're not going to get the infection or be infected by the patient, because whether we like it or not, we are dealing with body fluids, saliva, blood, and everything, that there is a possibility that you will be touching some parts of your dental chair, your instruments, and you contaminate them. Okay? So once you remove your gloves, nakalimutan mo, nahawakan mo pala yung handle ng iyong headlight, and so on and so forth. So you did not wash your hands right away, nagkaroon na ng kalat ng microorganisms in your clinic. Okay? So risk management, therefore, involves the identification, assessment, and analysis of the risk. What are the conditions that predispose, or what are the conditions that may lead to the possible contamination of people inside your clinic? Okay, so assessment and analysis of the risk and the implementation of the risk control procedures designed to eliminate or reduce that risk of transmission. So in the risk analysis or assessment, okay, we have to consider the different infection control guidelines set by local government or set by the national government, especially the agencies that are in charge in dealing with healthcare procedures. So this would be the job of the Department of Health, as well as the Department of Environment and Natural Resources, because we have to consider also the proper disposal of our medical wastes. Because whether we like it or not, those are soiled materials, those are soiled instruments, there are chemicals that we will be using, and it is but proper for us to make sure that these contaminants, possible contaminants or wastes, okay, will not spread and involve other localities or other areas within your jurisdiction. Okay, so especially we don't want that our clinic has a lot of waste of different kind. Okay, because it doesn't show, okay, a clinic, a medical clinic or a dental clinic, if that's the case. Nakakita na ba tayo ng dental clinic na parang palengke? Nagkalat yung mga waste natin doon. Gauze, cotton with blood, or gauze with blood, gloves, disposable gowns. Okay? So, I don't think so that there is a dental clinic with that kind of setup or with that kind of environment. if I were the patient, that will be the first and the last time that I'm going to visit that clinic. It only speak of the quality or the attitude of the people manning the dental clinic, if that is the case. Okay? So, ibig sabihin, pag dugyot yung nandoon, talagang dugyot talaga yung kapaligiran niya. That is to say. Okay? So, these infection control guidelines, okay, entails about the best practice available. Okay, so you will be taught later on the proper management of your patient. Okay, including how you are going to run your dental clinic later on, or as a dental clinician or future dental clinician, you will be reminded of the things that you have to observe and you have to do during your stay as dental clinicians in the dental infirmary. Not only in the dental infirmary, but also in the classrooms that you're going to occupy later on for your lecture and sometimes for your laboratory activities. So you will be reminded of proper disposal of your waste and proper maintenance of cleanliness, okay, and orderliness in your respective classroom or laboratory rooms, especially in the dental infirmary. Okay. Then, of course, infection control guidelines are also formulated based on the evidences or based on statistics gathered, okay, through time. So, meaning to say, those guidelines were formulated because there were a lot of perhaps high incidence of that kind of infection or that kind of disease related to dental practice. So nakalagay lahat doon in order to control and contain, okay, that kind of infection or disease that might be present or that might be transmitted from one person to the other. We are not just talking about patients, my dear students. We are not just talking about the dentist, the assistants, and so on and so forth. We are also talking about all possible people that could enter your clinic, such as guardian, yung mga parents, okay, friends, okay, other patients in your waiting area or reception area, okay, those people can also harbor or can also be infected, or there is also a risk of possible contamination once there is a contaminant inside the clinic. Later on, we're going to identify possible contaminants or hazards inside the clinic, which might endanger the health of our clientele or our patients in particular. Okay, so take note that the goal of risk assessment is to eliminate or to reduce the possible risk of transmission of disease or infection. Okay, so the standard infection control precautions or SICP treats all body fluids, okay, with exemption of sweat. So when you say body fluids, we are talking about saliva. Okay, whether we like it or not, we will be dealing as a dental student and future clinician and future dentist. We are dealing with the oral cavity. So that is where our work is. Okay, intraorally during restorative endodontic procedures, prosto, surgery, and so on and so forth. Okay, our work is within the oral cavity. So we are exposed to saliva, the blood, or sometimes we are exposed also to respiratory secretions. Okay, that's the reason why during the pandemic, okay, we are, of all health providers, we are at high risk of possible contamination because COVID-19 virus, okay, is airborne. So, medical doctors, hindi masyado, although they are exposed in the hospitals because during that time, halos lahat COVID patients. Kawawa yung mga may sakit na iba kasi they are at high risk of possible contamination kahit naka-isolate yung mga but the personnel, okay, hindi naman pwedeng yung doktor lang nakatutok sa mga may COVID-19, yung napabayaan na yung may patients. So there is still that possibility of cross-infection. Okay, but the dental practice nosedive during the pandemic time, okay, or during the COVID-19 pandemic. Okay, because of that reason, we are at high risk of all medical professions or medical health providers. So, in-stop muna yung dental practice. Okay, so medyo mahirap ang buhay ng dentista noon. Bete pa yung mga nurses, bete pa yung mga doctors, okay? Meron silang trabaho, but, okay, they are exposed. Yun naman ang kwan nila. May trabaho nga sila, pero sila ang frontliners. So, some of them sacrifice their lives just to save other lives. Okay? So, they are hero in the sense that they made the greatest sacrifice of all. Okay? To sacrifice their health and life for the sake of humanity. Okay? So, as a source of infection, so SICP are a series of measures and procedures designed to prevent exposure of staff or patients to infected body fluids and secretions such as, yun, sinabi natin kanina, blood, saliva, respiratory secretion between patients and operator. So these are the summary of, or this is a summary of the standard infection control precautions. Okay? So we have to observe proper hand hygiene, use of gloves, use of facial protection such as surgical mask, face mask, visors or goggles. Okay, hindi po goggles. Okay, number 4, use of disposable aprons or gowns. Okay, we can use scrub suit, but make sure that the scrub suit is only single use and it should be changed every after patient or every after use, and do not reuse that to your other patients because that is already considered contaminated or soiled. Okay, but if it is disposable, so you have to throw it properly in a designated trash bin. Okay, prevention and management of needle stick and sharp injuries and splash incidents. Okay, so take note, in handling sharps, we will have a separate discussion with regards to the proper handling of sharp instruments, including the proper disposal. Okay, so needles as well as blades. Okay, then use of respiratory hygiene and cough etiquette, management of used surgical drapes and uniforms. So when we say drapes, these are just like a towel or just like a bib, but there is an opening accorded to the area which the surgeon or the operator or the dentist will work on. So we usually see this in clinics and hospitals during surgical operations. Yung pagtanggal nila ng cyst in the skin, okay? Or if not, when they do cleft lip and cleft palate surgical procedures, orthodontic surgical procedures, surgical removal of impacted third molars, okay? Or especially when patients are under sedation, they usually put drapes. So kasi nasa OR. So balot na balot yung pasyente. Ang naka-expose lang is kung saan nila o saan sila mag-a-access. The rest are usually covered with sterile drapes or uniforms. Ang uniforms na to mga gowns. Okay? So aside from the surgical gown na ipapalagay nila sa pasyente, meron pa mga drapes yan, parang blanket na green, okay, ilalagay sa kanya. So balot na balot yan. Okay? Kasi maginaw or malamig. Okay? If the patient is under general anesthesia, it is usually cold. No? So ensure safe waste management and safe handling and decontamination of dental instruments and equipments. So we will have, as I mentioned earlier, we will have a separate discussion with regards to the handling, proper disposal, as well as proper disposal of instruments, soiled instruments, needles, and other sharp instruments, and contaminated instruments. So how do we perform a risk assessment in the dental clinic or in our dental practice or as a dental clinician or future dental clinician? Okay, so number one, we have to identify the presence of a threat or a presence of what we call hazard. We have to identify what are the potential hazard in our clinic, example of which are chemicals. Okay, so we're going to discuss one by one later on. So may I just present to you the different risk assessment, or so the steps, okay, in the risk assessment management. So identify the hazards, decide who might be harmed and how. Number three, evaluate the risk arising from the hazards and decide whether existing precautions are adequate or whether more needs to be done. Number four, record your findings, focusing on the controls and not the remedy. Prevention, again, my dear student, is at most important. Number five, review your assessment periodically and revise it if necessary. So it takes time before you'll be able to develop your skill, okay, and develop your knowledge with regards to this kind of assessment. At first, maybe we are at call this we are at lost, or we are not yet fully trained to do it. So there are loopholes and there are shortcomings, something like that. But everything can be learned through experience. Okay, so you just open your mind, and you have to be open-minded in such a way that you have to always remember that in everything that we do, there is always a room for improvement. And we should not be satisfied with what we have, but more so, we have to find ways in order to improve whatever guidelines or whatever things or plans, okay, or procedures we have in our clinic. So the existing one, if there needs to be, if there is a need for us to improve or develop, then we have to do it. because sooner or later, that will help us improve our practice. Don't you know that patients are usually keen observers, that some patients, if not majority of patients, would try to look at the clinic first, the surroundings, before they will enter your clinic. And if your reception is not that attractive or is not that good, maraming kalat, papel, and everything, okay, it is not organized, in other words. Okay? Magdadalawang isip yung mga pasyente natin. Okay? The best place to attract your patient is your reception. Kasi doon mo kakausapin yung pasyente, and if the environment is good, you have to consider, of course, in your practice management later on, your teacher there will talk about the clinical setup. Okay? So ano yung mga ideal na sizes ng mga operatory, your reception rooms, ano ba ang mga nandun, including the color, including where you're going to position the tables, some furnitures, and so on and so forth. So part ng practice management yan. So I leave that to your teacher or instructor in practice management. Okay? So identify the hazard. So how are you going? Who will identify the hazard? So divide your work into a manageable categories. So meaning to say, you're going to itemize, or you're going to categorize, okay, your work in such a way na madali siyang i-manage. Hindi yung minsanan. Okay? So you have to simplify. Okay? You have to simplify the categories in such a way that you can easily manage, or you can easily handle. Just in case something happens, okay, madali mong ma-identify. So like for example, in the so it has to do something with the proper arrangement, maybe, or proper placement of your instruments, materials, which you have to separate disposable from non-disposable, hazardous material to non-hazardous material, something like that. So in other words, you have to organize everything. Okay. So if there are some clinics, okay, where they usually they put some labels. Okay. So nakalagay doon towels, etc., etc. So prosto materials, resto materials, gloves, disposable gown, and so on and so forth. So it is properly organized. So if it is nice to work in a place wherein everything is put into place. Okay? Or organized. Madali. Alam mo na kung saan mo hanapin eh. Di ba? So for that will also help you in the proper inventory later on. Alam mo na kung ano yung kulang, and so on and so forth. So you have to do some sort of inventory so that you will know what materials or what instruments, what are the things that needs to be replenished. Okay? Para meron kang gagamitin ulit in the future. Concentrate on significant hazards which could result in serious harm or affect several people. Ask your employees for their views. Involve the whole team as much as possible. So ito yung tinatawag nila na empowerment. So you have to involve the whole team. While it's true that the dentist is the manager or the leader or the boss in the clinic, however, because the dentist usually focuses only his attention most of the time on his patient, or her patient, that some tasks are delegated to other person. If you are the manager, if you're a good manager, and you delegated a particular work to a particular person, you have to respect that person whom you give that blessing or you give that task or duty. So sabi nga nila, respect begets respect. So pag pinasa mo yung responsibility and you believe in the capability or potential of that person, let him work. Let him work the way you want the work to be done. Of course, under your supervision, but you have to make sure that you have that ear to listen to your dental team. Okay? Mahirap yung authoritarian. Okay? So gusto ko ito, dapat ganito ang gawin nyo. Ay, hindi ganon. For a good personal relationship or for a good working atmosphere, there has to be what we call team effort or team play. If you're a player or a good team player, you must have that characteristics. Okay? So it's always good to listen to somebody or somebody else. Okay? Huwag yung makasarili na halos alam mo lahat yung ginagawa mo. No. Take note, nakatutok ka lang sa pasyente mo, hindi mo alam yung mga kung ano yung wala, kung ano yung kwan. That is the responsibility already. So if you delegate the work, you have to believe in the potential of that person. If he lacks along the way, maybe medyo mahina siya ng konti, empower mo siya, you help him realize how important his work is for the entire clinical operation. Okay? So separate activities into operational stages to ensure that there are no hidden hazards. So make use of manufacturers' data sheets to help you spot hazards and put risk in their true perspective. There are some chemicals that we use in dental practice. Just to give you a concrete example, my dear students, there is a chemical that we use, an acid medium at that. We use that in restorative. One is used in restorative procedure. If you've been through a dentist for some dental fillings or tooth restorations, tawag natin na pasta. Okay? Dental fillings like composite or wala nang gumagamit yata na amalgam ngayon. I don't use amalgam anymore as a dental filling. Yes, Miss Cabero. Miss Cabero? Hello? Wala. Napindot lang yata niya. Nawala tuloy ako. So, sa dental, sa restorations, so there is that called etchant. So this is made up of 35 up to 37% phosphoric acid. That depends on the manufacturer. Okay, Dentsply, I think they have 35% phosphoric acid, and they have also 37% phosphoric acid. So this etchant, just to give you an idea, okay, this is a chemical that is used in restorative procedure to create, okay, a mechanical, okay, as well as chemical undercut to improve the bonding of the restorative material. Para dumikit siya, hindi siya kaagad matatanggal. Okay? But there is also an etchant that is used exclusively for the cementation of a porcelain crown or a zirconia crown prior to cementation. So we flood the inner surface of the porcelain material kasi nag-glaze yan, so makintab. So pinaparaf namin muna o pinaparaf muna natin so that it will create a chemical as well as certain kind of mechanical retention. Okay, so the rougher the material inside the crown, the better would be the bonding of the material or the cement. Resin cement usually ang ginagamit dyan. Before, ang ginagamit lang nila is the powder in liquid. Okay, so mix them together. Okay. Then apply. Then let it cure by its own self-curing. Pero ngayon is like dual cure. Okay? Light cure, kahit hindi mo na-cure ng husto, mag-cure siya kasi dual cure siya. Light cured as well as self-cured material. Dual cure ang tinatawag nila doon. So yung phosphoric, yung acid na yon, okay, is not called phosphoric acid because phosphoric acid only is used to roughen the surface of the tooth, okay, before it receive the composite material. Okay, but for that purpose of crown cementation, ang ginagamit naman nila is hydrofluoric acid. That hydrofluoric acid is biohazard. So, ginagamit lang yan extraorally. So, you have to wash that thoroughly. Make sure na lahat ng hydrofluoric acid is removed prior to the cementation of the crown. Because if the hydrofluoric acid is ingested by the patient, there is a possibility, depending on the amount, of course, and the concentration of the hydrofluoric acid ingested or nalunok, accidentally or otherwise, okay, pwedeng ma-hospital yung pasyente. And if that hydrofluoric acid touches a mucosa, or if not, accidentally pumunta sa mata ng pasyente or mata ng operator, you have to bring the patient to the clinic or if not, to the hospital as much as possible because that is hydrofluoric acid. It will destroy and it will irritate, okay, the mucosa or the lining of the eyeball as the case may be. So it could lead to blindness depending on the severity of the case. Kung saan tumalsik, okay, kung sa pupil of the eye tumalsik, sa cornea tumalsik, ay medyo mas malaking problema. That's the reason why nakalagay doon merong markang demonyo. Okay? Nakikita natin, no, di ba yung poison? Okay? Nandun yung skull as well as, I don't know if that is the humerus or femur. Okay? Basta may naka-X na ganun, tapos bungo. Ayun. Ibig sabihin nun, poison or biohazard or health hazard. So we have to identify those as much as possible para alam natin which chemical is to be handled carefully. Okay? Because there is a potential risk to injure yourself or the patient or your staff. Review past incidents and ill health records. So if just in case something happens due to mishandling of chemicals, you have to write it down in the patient's chart so that you will be reminded of that you are to be very careful the next time you handle the same chemical. And if just in case, okay, it happens, you have to write also the procedure that you did in handling the situation. Ano bang pinagawa mo? Natalsikan yung kanyang mata nung pinagawa mo, pinaghilamos mo ba siya? Okay? So, did you send the patient right away? Did you accompany the patient to the hospital or clinic for further management and so on and so forth? So you have to write this down because if there will be that course of investigation by the agencies, kung nagsampa ng kaso man yung pasyente mo, dahil ganun ang nangyari sa kanya, nabulag yung kanyang isang mata, kasi ganun natalsikan habang nagpapa-treat sa'yo, then you have something to show that you did your best, but your best wasn't good enough to handle the case. Okay, so hindi po kanta yon. Nagkataon lang na doon papunta yung explanation natin. I did my best, but my best wasn't good enough. Okay? So, who might be harmed? Dentist lang ba? Staff lang ba? Patient lang ba? Or other people present in your dental clinic? So, identify all members of staff at risk from the significant hazard. So, do not forget people who only come into contact with the hazard infrequently. Example, yung visitors, the general public, and people sharing your workplace. So, let's say for example, merong mga maintenance contractors. So, sabi mo, may mga plumbing ka ipapagawa, okay? Or if not, barado, yung drainage mo, and so on and so forth. Remind them also that the drainage, in one way or the other, okay, is contaminated with chemicals that we use. Okay, so please wear gloves, okay, thick gloves, especially in handling liquids inside the pipeline. Okay, baka po kasi siyempre diyan dumuduro yung mga pasyente, contaminated diyan with blood. There are a lot of fluids coming from different people and so on and so forth. So please wear your gloves, wear your mask, and please wear goggles kasi baka po matalsikan yung mata nyo, something like that. So you have also to remind those people. Same is true when you throw your medical waste like sharps and all these blades. You have to make sure that you separate or put that in a separate container, which will also protect the collectors, garbage collectors, so that they will not be contaminated just in case, okay, para walang chance na mahawakan nila yung sharp objects so that they will not injure themselves and that get contaminated. Okay? Highlight those persons particularly at risk who may be more vulnerable, such as pregnant women, immunocompromised patients or staff, people with disabilities, inexperienced or temporary workers, and lone workers. So, yan po yung mga kailangan nating pagsabihan. Third, evaluate the risk of a level of risk. So our aim is to eliminate or reduce all risk to a low level. Okay, so we have to identify people, okay, who are of high, medium, or low risk. So concentrate on the high risk individuals. So ito muna ang ikon natin, sabihan natin. Okay, so let's say for example, mayroon tayong nakita doon na dati mong pasyente, may sinamahan siya, immunocompromised patient, you may say it in a nice way that would be better for him if he will just wait for the patient outside, or if not, since the patient is already adult, okay, and he can give his own consent to undergo the treatment, you may ask the medically compromised or immunocompromised patient to just leave the patient, okay, because you don't want him to get contaminated. Because remember, there are some airborne microorganisms present in the dental clinic, and that might get into the system of the medically compromised patient. Okay, so as much as possible, medically compromised patients are confined at home. Okay, so that because their defense or immune system is very low. Madali silang kapitan ng sakit. Kawawa naman sila. Okay? Examine how work is actually carried out and identified failures to follow procedures of practice. Need to comply with legal requirements and standards. And the law says that you must do what is reasonably practical to keep your workplace safe. Kaya sabi ng batas, okay, whatever happens to your patient, okay, you will be responsible once the patient or the person enters your clinic. So make sure that everything is safe in your clinic. Like for example, kung na-identify mo naman na yung dental chair mo is rocking and needs to be repaired, ipa-repair mo na. Kasi pag nahulog yung pasyente mo dyan, okay, bumigay yung dental chair or stool or what, or bench, at nabalian ng buto kasi matanda na yung kasama ng pasyente mo, you will be responsible for it. You will be accountable to the person or to the hindi ko kasalanan yan, kasalanan ng bench. Kasalanan, wala namang isip yung bench or wala namang isip yung chair na inilagay mo dun. So if you identified possible hazards, you do something in order to protect the interest not only of the patient, but also all the people who want to visit or enters your clinic. Be it potential or not potential patient or non-potential patient, you have to give them due respect by accommodating them as much as possible. Because whether you like it or not, once you give them or treat them nicely, mind you, these are the same people or these are the people who are going to mention about your kindness, your being polite, being considerate, and being humane. Okay? Napakabait ng dentista na yun. Okay? Sana pamarisan. Hindi sana kunin na ni Lord. No? So, sana pamarisan. Parang ganun. Okay? So, record your findings. So, ano yung mga i-records natin kung may nangyari or man or whatever information based on our assessment. If we already identified the possible risk or hazardous materials or things in our clinic, so we have to list down and put this in writing. So activities or work areas examine. Okay, so which part, okay, or which part of your clinic or workplace, okay, is seem to be not conducive for patient to stay. Kasi yung mga tiles mo nakausli, may mga kalat, may mga basura, ganun. So you have to make sure that everything is in order. Okay? Hazard identified, persons exposed to the hazards, evaluation of risk and their prioritization, existing control measures and their effectiveness, and what additional precautions are needed and who is to take the action and when. Okay, so let's say, for example, you have identified that before in front of your clinic, so medyo may nangangamoy, So mayroong mga drainage na kwan and so on and so forth. That is also your responsibility. Okay? Not because that is in front of your clinic, but more so that you are concerned with the general welfare of the community or the population. Ikaw din ang kawawa pagka bumaha, lahat ng putik, lahat ng maiitim na liquid, pwedeng pumasok sa clinic mo and it will contaminate your clinic. So you have to identify all of those things, not only inside your clinic, but also in the perimeter of your clinic. Nakatulong ka na sa gobyerno by identifying those problems, hopefully, and you just pray that they will act on it immediately. Okay? Para hindi lumala yung sitwasyon. Okay? Pero whether we like it or not, in reality, okay, sinabi mo ngayon, ang action, bukas makalawa. Or if not, after a week, after 2 weeks, after a month, or before the election. Review your assessment. So risk assessment is a continuing process. It must be kept up to date to ensure that it takes into account new activities and hazards, changes in processes, methods of work, and employees. So, meaning to say, your risk assessment doesn't only end in identifying the potential hazard, but more so, you have to take action, you have to do something in order to improve the entire process. Okay? Do not be satisfied or contented with the existing, okay, guidelines or existing method that you employ in your clinic. There are, I personally believe that there is always that room for improvement for everything to make the situation more effective and more satisfying. Not only to you and your dental staff, but to the general public, especially your patients. Okay, so this is the hierarchy of risk management control. So pag sinabi nating hierarchy, so from top to bottom. Okay, so number one is the elimination. Okay, eliminate. So what are you going to eliminate? So let's say for instance, so may mga nag-expire na ba na mga goods mo dyan or materials mo or yung mga, let's say for example, gumagamit ka ng mga disinfectants. Like for example, gumagamit ka ng Clorox to disinfect your sink and everything there. So make sure na nakalagay sila sa proper place and hindi sila na proper place at hindi sila expired. So yung mga expired, eliminate mo, itapon mo na sila properly. Okay, and buy a new one. So just in case naman may tayong mga chemicals that you think is biohazard, baka meron namang possible na substitute or alternative that serves the same purpose but less risky or less hazardous. Okay? So may mga areas din na kailangan mo ilagay sa cabinet, okay, para hindi masipa at hindi mabasag, especially those that are contained in bottles or jars such as chemicals like alcohols. Okay? So consider biohazard yan kasi pagka kung pwedeng magliyab yan, denatured alcohol, rubbing alcohol, okay? And so on and so forth. Okay? So segregation of people as well as machines or materials, safe systems of work, only to the acceptable level. So, ibig sabihin nito, so do not overdo it. So, yung sa trabaho, okay, as much as possible, make sure that if you are productive that day, okay, kung sa tingin mo medyo pagod ka na, okay, siyempre pagod na rin yung mga makina mo, pagpahinga ka na. Because remember, those machines are running 8 hours, 10 hours a day. Kung minsan nag-overtime ka pa, wag naman ng 12 hours. So, maximum of, let's say, 8 hours. Maximum na yon. Okay? To protect yourself and, of course, to protect your staff also because you need to rest. So, you have to be productive. Make sure that if you are productive that day, 8 hours is enough. 6 hours pa nga kung minsan as you grow older. In my case, okay na sa akin yung 4 hours, actually 5 hours. I'm good with that. Okay? Before, 8 hours. So, medyo bata-bata pa tayo pero medyo nakakaedad na tayo. Ilan na taong ko ngayon? 42. So, medyo may edad na rin. Dr. Fernandez is 10 years old. 10 years younger than I am. Okay, so written procedures that are known and understood by those affected, adequate supervision, okay, identification of training needs and implementation. So there are nowadays it is mandatory for dentists to undergo BLS. Noon kasi hindi pinapansin ng gobyerno, hindi pinapansin ng mga kanyan. Pero I find it very important in the sense that if there's something happen, not only in workplace, pwede mangyari kasi yung magbigay ka ng basic life support in any place, like for example in mall, in restaurant, may nabilaukan, okay, na identify mo, nakita mo na the person need help, you can be of help to person and you will save life. You can save life, okay, if you know how to do it. But if you don't know how to do it, napanood mo lang and you don't know how to give artificial resuscitation, when to give AR, CPR, wag mo nang pangarapin gawin kasi baka doon pa madisgrasya yung pasyente. Okay, nakakahinga pa yung pasyente, binigyan mo ng artificial resuscitation. Okay? Dahil maganda yung pasyente, okay, imbis na hindi na kailangan ng artificial resuscitation, mouth to mouth mo. Okay? Hindi ka na kontento, ni nose to nose mo pa. Hindi ka pa rin kontento, may nose to mouth mo pa. Okay, so hindi na tama yun. No? So you have to know. You have to go undergo training in order to know how to administer proper basic life support. Okay? Okay, information instruction like signs, handout, and policies, and of course, we need to wear PPE, personal protective equipments, not only gowns, okay, but also face mask, face shields, head cap, and so on and so forth. We will have a separate discussion about PPEs later on after the first grading examination. Okay, in some countries, they have what they call Infection Control Act or law. Okay, for instance, in UK, okay, they have what they call Health and Safety at Work Act of 1974. Okay, and in England, they have also the Health and Social Care Act of 2008. Okay, then they have amended this to in 2014. These are the instruments that they embrace in all the majority of their risk assessment management. Okay, so we have our own guideline with regards to this, issued by the Department of Health. Okay, so they have also what they call Health and Social Care Act of 2008, as well as in 2014, Health and Safety Act at Work or Safety at Work Act of 1974, Control of Substances Hazardous to Health Regulations in 2002. All of these acts or regulations or laws are geared towards protecting the interest of the majority. It is not in favor of the dentists or dental professionals or medical health workers, okay, but it also protects the interest of the people in general. Okay, so this act or this law, enacted by the government or agencies, be it national or local agencies, okay, is designed or are designed to protect the interest of everybody. You have to remember that, my dear students. It is not in favor of the medical profession alone. It also protects the interest of the general populace. Yes, Mr. Ito. Miss Solomon, you raising your hand?
Hello po, sir.
Yeah, hello, ma'am. Good evening po.
Ay, sorry to disturb the class po, pero I think time na po kasi namin. Time na po.
I'm sorry, I'm sorry. So,
Okay
medyo
lang po, sir.
7:45 na pala. Okay. So anyway, that was the last slide.
Thank you
I
po.
am about I'm about to finish na the lecture. This is the last slide actually. Okay, so when is our examination? Kailan yung exam natin? Kailan i-start yung exam?
Next week, sir.
Next week, 19 to 22. So, ano yung 19? Wednesday? Well, can you check? Please check
Yes, sir.
your Wednesday. So we will still meet on Tuesday then for the lecture and update or announcement to be made in preparation for your first grading examination. Okay, so keep posted. So I'll be giving the announcement in our GC. Okay, kung anong gagawin natin sa Tuesday. So if if there will be questions, should there be any questions you want or clarifications you want to make, please reserve them for next meeting because it's already time more than okay the period allotted for us. So please reserve your questions next meeting, and I'm more than willing to answer them. So thank you very much for your time and good evening. Yes, Cabero?
Sir, face-to-face po ba yung exam?
The examination, it's good na tinanong. I'm sorry, but the examination will be given online. But I will be there in Baguio last week of September. So we will have face-to-face after the first grading examination for the lecture. 2 meetings at least, Monday and Wednesday. Last week of September. Yun ang schedule ko na pag-akyat ng Baguio. Okay?
Sir, sa 19 pala, Tuesday po.
Tuesday yung 19. Kung Tuesday yung 19, 20 lang ang exam natin? 22.
19 to 22 po.
Yung 22 na yung kung natin. Di bale, sabihin ko na lang yung coverage ng exam ninyo at kung kailan. Because I still have to make arrangement in the office with regards to your examination. Para hindi sabay-sabay, hindi kayo mahirapan. Ako
Yes
na
po.
yung mag-adjust para sa exam ninyo. Okay? Okay? Wala na? Okay, so I think that
Sir,
will be all for...
Sir,
Yeah.
TTH po yung schedule po natin.
Titignan ko yung schedule kasi wala pa silang pinost sa akin kung kailan yung at even. But I can make arrangement just in case nagkataon na marami kong exam sa time na yun. Please let me know para pakiusap ako sa office na pwede natin i-adjust. But within the examination week. Okay? So the earlier the better. If you inform me the earlier the better. Para I will make the necessary adjustment. Okay? Will that be fine for everybody, or would you prefer to stick with the original schedule of your exam? You talk about that among yourselves and please let me know ASAP. Okay? Okay, sige. Para may time pa kayo umuwi sa bahay nyo, it's already 10 to 8. Thank you very much and good evening. Keep safe, everybody. Bye.
Thank you po, sir.